So much. Thank you so much. Thank you for the introduction and thank you for the opportunity. One of the things that he said, I mean, we'll deal with real life situations and real things that we have been seeing for the last few years. So when he's talking about keeping the data available for up to 5 years, we have looked into data of scientific research 20 years down the line. And so there is a situation where we talk about metformin versus insulin versus other medications and how a person is better and how the death rates and mortality rates are different. So when we compare the two groups, so most of the studies that come to us as reviewer or as editor, we do not have descriptive data submitted by the author. So you have to have the descriptive data. This was the groups, the analysis, the statistical analysis of the descriptive data to show that in terms of differences, the two groups were not different. So when he's talking about data, we are talking about blood sugar fasting and PP. In one study, the fasting and PP was equal in both the patients. So 500, 500, 200, 200 fasting. But metformin seems to be better and it does not give rise to an issue. But when we look at the study 20 years down the line, when we go and ask them for the CRF form, the case report form, and we look at the data and we say there must be something else. So let's look at that, and then we find out that glycosylated hemoglobin and the glycosylated hemoglobin, both the groups is different. So the metformin group, at entry the glycosylated hemoglobin was better, and that is why the patients didn't die. Whereas in the other group, so your research can be completely nullified even 20 years down the line if you have an access to the data. There are researches in which there are two different things that can come in. So I'll start with the presentation. My disclosure is none, except for the fact that most of the slides are with the statistics group at KEM Hospital, Dr. Nitya Kokte, Dr. Kanu Singhal at Hinduja Hospital, and Ranjit sir. I am also a Cochrane collaborator since 2006, so this is my second decade in Cochrane. I have lectured for COPE, I will Diabetic Eye Care Committee, Technology Review for Racing, and associated with 5 editorial groups. WAME, the World Association of Medical Editors, COPE, Council of Science Editors as its ex-board of directors. And these are my roles in the Council of Science Editors, and I have a conflict of interest here that we talk about artificial intelligence now in publishing, artificial intelligence in statistics, artificial intelligence in searching for plagiarism. And so as Council of Editors, we are now looking at a lot of things where artificial intelligence is concerned. So this presentation is not talking about artificial intelligence, it is not talking about network meta-analysis, which is the latest way in which you look at multiple variables. But whatever I say here, if anybody is interested, they can come over there. Those are paid $25 or $50 at max webinars for 1 hour. The objectives, he has already enumerated the types of data, so I'm going to skip that. So well, let's begin. So where are we? I mean, this is still me. At the end of 3 decades of doing statistics, it is still me at the beginning. So do we have a pointer? So when it comes to statistics, you will start with a certain amount of statistics, the bell curves of statistics, and you go to the detailed examination of statistics. But when you finish something, so like you have FACO taking over ECC or SICS taking over ECC, and then you have micro FACO, and then you have other things coming in, statistics changes. So you are always going to be there. So a CPD in statistics is something that is extremely important. So we were talking about meta-analysis, but the latest review that I have done for a paper on intraocular lens calculations, that talks about network meta-analysis. So you are doing Bayesian network meta-analysis. This is completely extraordinary. After 18 studies or courses which I have done, this was never taught in any of that. So you are always going to be there, so please keep upgrading. So the broad topics of research, and so he's already spoken about data and the research question. Once the research question comes in, the commonest things that will come to our mind is what would be the research question about? What is it that we are going to look at? We are looking at therapy or effect. So most of the times, most of us clinicians are looking for effect. मैं ड्रग का क्या इफेक्ट हुआ, सर्जरी का क्या इफेक्ट हुआ, इज सर्जरी गोइंग टू हेल्प, is this particular drug going to be help, how is it going to help compared to something else. So for that you are going to need a RCT. Sometimes you are looking at diagnosis, for which you will do a cross-sectional survey like just spoken about. So that can be validity of a test. Can we trust a test? Can we trust HRT versus OCT, or can we trust HRT better than the visual fields, or what is going on? Sometimes you look at reliability. Can we get the same results again and again? DCT, can we shift over to DCT or Pascal stenometer instead of applanation? So these are the questions that will come to mind. So for this you will now have to do a different type of study. So that will be cross-sectional surveys that you will have to do. So you will have to take a cross-section. We'll come to that. Screening. So you have to screen the what is the percentage of people who have glaucoma in this room. So we'll screen this cross-section of people. Or what is the people who have glaucoma in Kolkata, in Vishwa Bangla Center area. So you'll look at that cross-section. So that is a screening aspect. Prognosis is the effect of early pickup. So if you're looking at prognosis, you're definitely going to do a study which is going to be over a long term. So it cannot be that I do a cross-sectional study today and find out what is the prognosis. I'll have to do it over 1 year, after 5 years, after 10 years, and then look at the study and how many people are dying, or how many people are getting worse, or how many people are getting better with a particular drug. So what is the prognosis of the case after I started this treatment? So that will need a longitudinal cohort study. So each of the studies will be different, and why I'm saying the study is different, because based on the study, and I'll skip the data part because he's already spoken of the data, so based on the kind of study you are doing and the kind of data that you have collected, whether it is parametric or non-parametric, whether it is discrete or ordinal, or whether it's multifactorial data. So on basis of that, you will have to choose your statistical test. Now, most of the times the statistician will come and tell you, let's use this test. But I have burned my fingers because there is my name associated with a study in which we studied the corneal endothelial cell loss after surgery, after 1 week, after 1 month, after 6 months, after 1 year. So we studied it 0 pre-operative 1 month, 0 6 months, 0 9 months, 0 1 month, and we did paired T. Completely wrong, and it bears my name. There is digital footprint. Dr. Sunil doesn't even know the basics. Okay, there is going to be a variation of the endothelial cell loss. So there's going to be 0, 1, 6, 9, 2 years. So there is going to be a variance. So you're going to do an analysis of variance. So you're going to do an ANOVA and not a paired T. So you give him 2 data, and the statistician is going to say paired T, sir. No, I'm going to look at it over 4 years. Alright, so then you're going to do an ANOVA. And now you're going to do a longitudinal study. So the longitudinal study, the statistical test used is going to be different. So some basic points, there are only 2 slides which are important in this whole presentation. Alright, so click a photograph of that 2 slides. Alright, and keep it with you, because that's the one which you're going to use for your students, for yourself, everything. So the study designs we all know. I'm not going to go into the details. So it is like the rats here. Random RCT, randomized control trials. So it's a controlled environment like you spoke about, and you need to randomize the nice way, because there are studies in which I have looked at studies which are highly quoted, highly cited, and I have told them later on that where is your randomization method? What is the randomization method that you use? And the randomization method is wrong, your study is absolutely invalid. So when people ask me, are you going to put this study into the diabetic eye care guidelines that you're going to write for the International Council of Ophthalmology? I'm sorry, the study has used completely wrong ways of randomization. How can I include this study? The study's weight is lost. I may still include the study, but the weightage is lost. And so when you draw that forest spot, the study doesn't have much weightage. So you want to look at the randomization, whether it is done nicely using tables or sequentially numbered sealed envelopes with computer generated random numbers, right? And both groups are then followed up for a specific period and analyzed in terms of specific outcomes. So you take it for 1 month or 6 months or 1 year, and you have to define that period well, because many times people take the period wrong. So I have followed it after 1 month. 1 month kuch effect nahi hoga. I did a DCR 1 month, everything is fine. Obviously everything will be fine. Alright, what is the follow-up that you're going to look at? Are you going to look at 5-year follow-up? And then somebody come and told me I did a 20-year follow-up. 20 year ka zarurat hi nahi, 5 years pe agar theek hai to 20 years pe it's going to be fine. So the specific period has to be specified in the research question and defined outcome. So what is the outcome that you have defined? That my IOP is fine. great. But what about the field? So you don't use surrogate measures. So the measures that you're going to use is going to be very specific, which are valid measures and not surrogate measures. Then you have a parallel group comparison. Each group entering the study at the same time receives a different treatment, and results are analyzed by comparing the groups. So this one rat is getting timolol, the other rat is getting latanoprost. And then you see there are slight differences in the rats, and you cannot make out this difference, and that is the delta that you're looking at. So the delta is how much change occurred. 2 millimeter से कम हो गया, 4 millimeter से, is that delta significant? So you have to use a significant delta. If I make the delta that I'm going to look at whether the IOP reduces by 4 millimeters, then both might be same. But if I see if the IOP is going to reduce by 1 millimeter, then I will get a statistically significant. So that delta is something that you really need to know. So where you will define that delta depends on where you are and what you are doing for which company. Or if I'm working as a KOL for a company, I will keep the delta very small. देखा latanoprost में कितना फर्क पड़ता है? Statistically significant difference, 1 millimeter difference. All right. But if I'm working as a hospital, I will say, sir, ये तो 1000 रुपए का drop है, that other drop is 40 rupees. Sir, we will look at delta as 4. Significant difference delta as 4. All right. Sir, latanoprost में इसमें कोई फर्क नहीं है. It is completely. So there is lies, there are white lies, and then there is statistics. With statistics, you can prove or disprove anything. So you need to be an intelligent person who knows what the statistician is trying to tell you, what the researcher is trying to tell you, what the pharma company is trying to tell you, and what the hospitals are going to tell you. Because you as a doctor are superior to everybody, because you have certain specific things that mind the patient is going to come and ask you. Paired match comparisons, like you have that rat matched with this rat. So this is a wrong pairing, because you have behind, you have a smaller rat compared to this rat. No? So you want to look at the descriptive statistics before. So when the paper is submitted, they will ask you descriptive statistics matched pair ka batao. Alright, so what went wrong in the metformin study was descriptive statistics matched everything, but glycosylated hemoglobin did not match. So if the glycosylated hemoglobin did not match, the whole study is invalid. Completely thrown out of the window. So subjects are treated matched to match confounding variables like age, sex, and other things, and they should be equal. So your descriptive statistics says age this much in group A, age this much in group B. The P value is non-significant. So they are similar age groups. There are similar number of males and females. So your descriptive statistics shows that both entry levels, they were all the same. Then you have to do blinding, single blind or double blind, we all know about this. You all, sometimes we do crossover study, latanoprost डाल रहे थे, फिर timolol में आ गए, washout period देखना पड़ता है. So you have to look at that washout period. If you do not look at that washout period, these are things that the clinician is going to talk about, the statistician is not going to talk about. Alright, so he's going to give you statistics, but the clinician should say, no, this is only 1 week, so this still might be the effect of your timolol. Right? So that is something that you want to look at. And you have sometimes placebo control. We also do sham surgeries, but you have to have ethical clearance for that, and that is very difficult. We now know there's something called as placebo effect, has a scientific basis to it. And then you look at tails of the study. So when you have a two-tail study, I have an IOP, I am using a drug, it is always going to reduce. It is never going to increase. So I need a single tail. But I am putting a patient through something, and I am giving a drug of which I don't know anything. I am going to now check for BP, but I am also looking at blood sugar as a side effect, or I am going to look at acidity, but I am also looking at side effect, or I am looking at infective ability and side effects. So the infective ability goes down, but the sugars are going down with Ciplox or something like that. So that can go up or go down. So the sugars can go up or down. So then you will need to use a two-tail study. Then you have factorial designs and cohort studies, which are carried over a period of time. So you are looking at monkeys. You are looking at Sunil Moreker. Sunil Moreker is still not evolved otherwise, except for his statistics. Otherwise, he's still a monkey. No? So you're following him up for 30 years. Then you have to do case control studies. Again, the same way you have to match. And then case cross-sectional surveys, like I talked about cross-sectional. And case reports. Now, is a study design appropriate for your question? That is the answer you're looking for. So am I doing a diagnosis and doing an RCT for the diagnosis? Rubbish, it's not going to work. Or am I doing a screening and doing an RCT?
how can you do an RCT for screening? So people tell me there is no RCT for this particular question. There cannot be an RCT for that question because an RCT is not the study design for that question. All right, so there are times when people argue their heart out, sir, there is no RCT to prove this. But there is no need for an RCT. The RCT is a wrong study design for that question. So you got to see whether the study design is right, the study design is sensible, and then this one slide, take a picture of this, and there's the other slide where you take a picture of the statistical test you're using. So the burden of illness, how much people have glaucoma, how many people are going to die of diabetes, how many people are going to develop diabetes. So you're looking at burden of illness, you're going to do a cross-sectional. So you're going to say how many people in which area, at which time. So I looked at 2024, from now on how much. So you then have to do from now longitudinal study. So you're going to do a cross-sectional longitudinal. So you're taking a cross-section of people, so you can combine these two study designs, cross-section and longitudinal. Causation, risk and prognosis, case control and cohort study. Occupational risk, ecological studies, treatment efficacy, RCT, diagnostic, test evaluation, you're going to do paired comparative, and cost effectiveness, obviously there you will need a, so study 2, anybody taker, any takers for this? Study 2 surgical procedures. What study design? RCT. Evaluate a diagnostic test, cross-sectional. Prognosis and outcome, longitudinal. Alright, and causation, case control or case cohort or case report. Alright, so then we need a null hypothesis. Are these two different? Alright, are these two different? You see that the wings are spread out, but the wings are together. They are not different because of that. The wings can be here and there. But what is the difference? That is the delta that I am looking out. And then you look at the variables. I am not going to talk about the variables in data. He's already spoken about the data, types of data. Only thing is that here we are not talking about the data. When you talk about data, the data can be distorted, skewed towards the right or skewed towards the left. Or the data can not be a Bell's curve, it can be a Bell's cone. So that is called as leptokurtosis, or it can be flattened, which is called as a platykurtosis, and then it is not normal. So you'll have to apply the other test. No? So we have come to that, and then we look at the statistical test, just 2 minutes. So if there are parametric data which means which follows the Bell's curve. So the mean, median and mode are equal, they are the same. If you find that, continuous data normally distributed. And non-parametric, continuous data, not normally distributed. There is a skew or a kurtosis or something like that. And categorical data. Now, comparison of two sample means. What is the mean of this sample versus the mean of sample? You do a student's t-test, alright? Sometimes you do a paired t-test, right? It uses a change before and after an intervention. So, pehle kitna tha? After surgery, fell by 40 millimeters of mercury, right? Reduces the degree of variability between the groups. And then ANOVA that I spoke about. When you're looking at multiple samples, you're going to do ANOVA and not a paired T. Non-parametric test, it tests proportions, ratios. Alright, so the Pearson's chi-square test or Fisher's exact. And testing ordinal values, which are ordered, you are going to use the Mann-Whitney test or the Kruskal-Wallis test. The use of non-parametric tests, the interpretation is that the p-value is significant. So I'm not going to run into the details of this. I just want you to remember which tests are required where. Alright? So you assess the difference between two groups. Two sample t-test if it is parametric data. This is one slide you want to keep in mind. Two samples, sample t-test. Two samples. If there are multiple samples or there are non-parametric, you're going to do Wisconsin rank test or Mann-Whitney test. It is non-parametric, Mann-Whitney. Alright? So, or Rendell's S. If there is an assessment of difference between two or more groups, one-way analysis, two or more groups, ANOVA, if it is parametric. So the same thing looking at means over a period, looking at cell count over a period of time, so ANOVA, otherwise you use the Kruskal-Wallis. To measure the strength of association or correlation, alright? And if it is parametric, so correlation coefficient parametric, and Kendall's tau if it, or Spearman's if it is non-parametric, and assessing the difference paired T or Wilcoxon sin T. So I'll run through this. So these are examples. I'm not going to talk about them. I'll come to the last couple of slides. So again, a test again for all of you all. Compare means from independent samples. Means from independent samples, and they are parametric, normally distributed. Mean, median, mode is same. What will we use here? Paired T. or student t-test, all right? And if it is non-parametric, Mann-Whitney or Wilkinson's rank sum. Then you can rank it because it's not the same. And compare means from sample, pair T, or Wilkinson's matched pair T. Compare 3 or more, ANOVA, or if it is non-parametric, Kruskal-Wallis. Compare proportions, when you talk about proportions, ratios and all, chi-square test of Fisher's, whether it is parametric, non-parametric, doesn't matter. Compared proportions from paired samples, it is going to be McNemar's test. And 2 continuous variables, Pearson's coefficient, if it is parametric. So people sometimes use Pearson's coefficient is significant, all right? But this is a non-parametric, so you can't use Pearson's. It is not normally distributed. But if it is not normally distributed and you use Pearson's, it's wrong. You have to use Spearman's, right? So you have to look at this one glance at the paper and you know this paper is completely non. Or somebody is trying to prove it. They are using a non-parametric test for a parametric data because you want to prove significance. Or you are using a parametric data for non-parametric because you want to prove significance and say, see, I did something nice, right? So this is the last thing. We are not going to look at specificity and sensitivity. Last thing we use is survival analysis when you are looking at cross-sectional longitudinal, right? And you have the Kaplan-Meier test, which all of us use it. And the Kaplan-Meier test, you have to compare group 1 with group 2, how many people are dying in group 1 or how many people are dying in group 2 or are getting worse or something like that. And if there are non-parametric Kaplans, then it is Mantel-Haensel. You can take a picture of this also, or a long rank test. And if there are more than 2 groups, it's a log rank or Mantel-Cox. Finally, he spoke about causation and association. So the last thing that I tell people is that there is a study which was done in which they said that there is an association between the sales of Pepsi and the number of ants in the room. So Pepsi के sales को ये देख के Coca-Cola के bottles के साथ एक पैकेट चीटी दे देंगे, sales बढ़ जाएगी. Alright, so you have to look at Bradford Hill's criteria for causation, because here the confounding factor is heat. Because there is heat, there are ants. Because there is heat, Pepsi sales are more. So you have to look at confounding factor, and that is where the Bradford Hill criteria comes. People say this is associated. It is associated, it is not causal. You show me the causal by following the Bradford Hill criteria. Strength, consistency, specificity, temporality follows it. Alright, biological gradient, plausibility, coherence, experiment, and analogy. So these are 5 different parts. These are the things that we do there. The last word, finally, if you think my presentation was just average, it's fine because you're actually being mean. Thank you.